I'm Shannon Weber with Hive, a hub of positive sexual and reproductive health.
I'm Juno Obidin-Malaver. I'm an obstetrician and gynecologist. I'm the Women's Health Fellow at the San Francisco Veterans Affairs Medical Center. I'm also the co-director of the Pride Study, which you'll hear more about later, and one of the investigators and founders of the Stanford LGBT Medical Education Research Group.
So, exciting topic today.
Yes.
Going to be adding a tab to our website about trans men.
Excellent.
And I want to find out from you, what do we know about trans men and babies?
Well, we both know some good stuff and don't know a lot. That's kind of the theme of what we're going to be talking about. So we know that trans folks are having families, or creating families, both trans men and trans women, and folks who are gender expansive and using other terms to talk about themselves. Trans men, myself and a few colleagues did a study, and we found out that, lo and behold, trans men are having babies, getting pregnant, having babies, both intentionally and unintentionally. So unintended pregnancies happen too. And so, it's a real human thing. People are wanting to have kids.
So some of the pregnancies are intended and some are unintended.
Yeah.
So that makes me think, from this reproductive health perspective, well, what do we know about trans men and contraception?
Yeah, even less. So, in our very small study, about 24% of folks had an unintended pregnancy. So to me, and the rate in the U.S. Among, usually the studies are done with cis women, is about 50%, and so a lot of these folks, even though they're on testosterone, may not have the contraception they need or want, because testosterone's it's not a contraceptive. You might stop having your periods, but still ovulate. And so if you're having sex with sperm in that interaction, you can get pregnant, and you still have a uterus, cervix, ovaries, and tubes.
And is that part of the conversation that happens when someone starts hormones, or so is that a piece that's missing, or?
Yeah, so I think it's both, on the provider level and also on the, patient or population level, that, if you have a uterus, ovaries, and tubes, you can still get pregnant. And that really all the societies, so the World Professional Association Transgender Health, Endocrine Society, they all say, before you start cross-sex hormones, you really should have conversations about fertility, about childbearing. But having said that, having spoken to a lot of folks in the community and having spoken to a lot of providers, those conversations are not happening. And so, or it's such a survival issue. It's such a pressing thing that people say, yeah. I just need to, for my health, for my well-being, I need to take this next step. Yeah. And family, fertility, and stuff, that's like a later discussion. Yeah. Because, and so it maybe is a discussion that should have happened and doesn't.
I think we also see outside of the trans man world that people get asked it once, and actually for all of us, it's a story that changes over time. Our child wish or our family wishes can change over time. Right. So anytime we try and implement something routinely, even if it was done once, it's not going to be enough.
Right, absolutely. And I think that that's so true. I mean, I think about my own life, and at 18, I felt very differently than at 25 than at, now, which is older.
26.
26.
Okay.
Exactly.
Is there a field then for trans men in reproductive health? And who is that? Yeah. Where, what is it?
Right. So I think there absolutely is, because there are trans men and there are men who happen to have a uterus, ovaries, and tubes. There is a field there. It's just sort of nascent and it hasn't evolved, it hasn't developed, and the real champions aren't fully developed in that. And I think a lot of that is because we're starting to be able to move from just survival and thinking about, how do we really just support people in transition and being who they are, to really thinking about thriving. So this idea of, expressing the full capacity of human lives.
The whole experience.
The whole experience. So that having been said, there are not a lot of people around the country that are focusing on trans men and their reproductive health and needs, gynecological needs, but then also obstetrical or having babies and family planning, also contraception. I mean, abortion. All of these things go together, and it's really about understanding both a trans inclusive piece, you know, because all of those services are going to be needed, but also trans specific pieces.
Right.
You know, so does contraception work differently if you're also taking testosterone? You know, are certain things just more acceptable, easier to use? What do people want? You know, all of those questions haven't been
totally answered
asked
yet.
or asked.
Yeah.
And that's the thing. We're just starting to ask those questions.
So if I'm a trans man and I want more information about contraception or about having a baby, where do I go?
Yeah. Oh, I wish I had like the place to go. I think some places are really starting to include that more. So I know that, you know, certain Planned Parenthood, certain providers are really starting to think about it. But unfortunately, there's not like the central website or anything. So most of the folks in the trans community I work with, you know, they hear about it's word of mouth, it's provider to provider. There's a few good resources. There's a book out by the Brown Boy Collective called Freeing Ourselves, and I forget the rest of the title after the colon. Maybe we can link it up.
Yeah, we'll link it.
But it's really about self-care generally. Health generally has a little bit on reproductive health and pregnancy and other things, but there aren't any, you know, real central great resources.
Yeah. So talking to somebody that I'm just thinking of that population level, like someone that I already trust, asking my provider if I don't get the right answer, maybe asking someone else.
Yeah, and then there are a few places, sorry, I should mention. So there's a few kind of central LGBT health centers that are taking a more, you know, sort of intentional approach on this. So the Fenway Institute in Boston has some good resources. Lion Martin Health Center in San Francisco, and then Callan Lord in New York City.
Great.
So they all provide services, but then if you're not happen to be in one of those areas, they also have some resources on the web.
Great. So this is going to be exciting because this video is going to be outdated even a year from now.
Yeah.
Because
and that's
it's
the hope,
like
right?
a whole field that's getting ready to unfold and looking for champions to come forward. It's so exciting.
Yeah. And interestingly enough, there's also sometimes allies in unusual places. So I work at the VA, Veterans Affairs, and there are a lot of providers that are trying to think about how we can increase and augment care for trans veterans.
That's beautiful.
So it's not there yet, but people are thinking about it.
It's beautiful.
Yeah.
Well, thank you for leading the way.
Yeah, well.
Being curious and being open to talking about it and helping us, the rest of us, understand how we could follow that.
Yeah, absolutely. I'm really excited to be working with a community here and, you know, really trying to think about how we can support the needs of trans men and trans individuals globally to meeting, you know, these really cool goals of having families intentionally. And then if it's an unintended pregnancy, also how to support that.
Yeah, important.
Yes, absolutely. Like full reproductive health and choice.
I love it.
Yeah.
Thank you.
Yeah. So I just want to put out one plug because I think one of the things that's going to help change that dialogue in the next year is going to be the project working on called the Pride Study.
Beautiful.
So check it out, pridestudy.org, and it's going to gather data over the long term.
And this is the first study like this. So even if someone's participated in a study before, it's different because it's been shorter term. This is going to be the true spectrum of LGBT and longitudinal, correct?
Right, absolutely. So the goal is at least 30 years to partner with people and really understand over time how does health change, health risk factors, but also resiliencies. You know, what makes LGBTQ community strong and survive and unique, and like let's showcase that.
Awesome.
Yeah.
Thank you.
Yeah.